in various communities across Toronto, and for some of you elsewhere in the GTA, are situated in the territory of many Indigenous nations, including the Huron-Wendat, the Anishinaabe, the Chippewa, the Haudenosaunee, and most recently, the Mississaugas of the Credit, land that is today still home to many Indigenous peoples from across Turtle Island. In acknowledging this truth, those of us who are settlers are called to honor and give thanks for these lands and to thank Indigenous peoples for the many benefits we enjoy from living on this land that their ancestors were stewards of for millennia. This is land that was stolen from Indigenous peoples over the last centuries of Indigenous colonization and genocide in Canada. To be meaningful, our gratitude must be clearly linked to our commitment as settlers to advance Canada's fulfillment of all 94 calls to action in the Truth and Reconciliation Report, as well as our own personal acts of reconciliation and allyship with Indigenous peoples. In closing, I offer this land acknowledgement of gratitude to those whose land acknowledgements I've drawn inspiration from in the past. And I welcome us all to co-create an inclusive space where all learn and engage with each other with respect. Miigwech. Having given thanks for meeting on this land, I'd like now to introduce myself. My name is David Myers. I'm the Senior Manager of Independent Living Programs at the Center for Independent Living in Toronto, otherwise known as CILT, and the lead on the COVID Accessibility Vaccine Engagement Project. I use he, him pronouns. I'm a Black cisgendered man with a physical disability. I have short salt and pepper hair that's getting saltier by the year. And I'm wearing a lilac button-down shirt and a black jacket. Next up, we'll do some brief housekeeping and guidelines before I pass it on. So first off, for folks, please mute and turn off your cameras during the presentation portion of the town hall. Folks are welcome to turn on their cameras and unmute during the question and answer period. We're recording this session so we can share it widely among folks with disabilities, our allies, and our partners to expand the reach of today's learning. A lot of folks aren't here today, and this is an opportunity to actually expand the learning beyond those of us who are here today. We're happy to say that both live captioning and ASL interpretation are available. If you need captioning, please click on the CC button along the bottom of your screen and the captions will appear. For ASL interpretation, simply make sure your view is set to gallery. And if you need it, please message Rebecca Wood directly in the chat. Rebecca will grant you capacity to pin the interpreter's videos to the most convenient part of your screen. We're giving a thank you shout out to our captioner, Tori, and our interpreters, Francine Gillis and Sharon Party, for being here. And thanks to Silent Voice Canada, Inc., one of our vaccine project partners, for coordinating ASL interpretation services for us today. Making events accessible to disabled and deaf folks is everybody's business. And CILT and our project partners are grateful to the City of Toronto for the funding opportunities provided to our accessibility cluster to model what true access can look like when access supports like ASL and captioning are embedded in city and nonprofit initiatives like this one. Rebecca will be monitoring the chat during the event. So if you have any technical issues, please just message her and she will reply and work to resolve the issue for you. And if you have any questions when speakers are presenting, again, please put them in the chat for the Q&A. Rebecca will queue them up to ask on your behalf. And lastly, we'd like to talk about our guidelines for conducting ourselves in this virtual space. We realize for many of us, this pandemic has been quite a painful and challenging epidemic, and it's aroused a lot of concerns and fears and anger even in folks who felt either left behind or not fully engaged in the vaccine rollout to this point. But our event team is committed to co-creating a safe space today where everyone will feel heard, respected, and safe to participate freely. Therefore, we'll reserve the right to remove anyone from the webinar who does not follow these guidelines. Thank you for honoring that. And you'll see the slide for the agenda. Next. As you see with the agenda slide, I just wrapped up the welcome and guidelines, so we're dispensed with that. Next on the agenda will be our first presenter, Wendy Porch, who's the Executive Director of CILT and the Chair of the City of Toronto Accessible Vaccine Task Force. Once Wendy's finished speaking, she will introduce Jess and Jennifer. That's Jess Pisarek and Jennifer Morin from Toronto Public Health. Both of them will be presenting important current information related to COVID-19 vaccines and answering frequently asked questions about them. Jess and Jennifer, we're thrilled to have you here. Thanks so much. And then lastly, we'll have John Massa, CILT's Independent Living Skills Coordinator and my CILT colleague. And John will share current information around COVID vaccine receipts, ways to access them, and many accessibility considerations involved. And after John presents, we'll have our Q&A period before our event wraps. We'll also use the chat as a parking lot for questions when speakers are presenting. So please feel free again to note your questions there as people are presenting on their various topics. And again, Rebecca will be happy to collect and queue your questions for asking. And now finally, I have the pleasure of introducing you to my coworker, my boss, Wendy Porch, CILT's Executive Director. Wendy will be talking about the critical need for an accessibility lens in the vaccine services and communications in the city, Toronto's Accessibility Task Force, the City of Toronto's Vaccine Engagement Project, 4 super supportive clinics that are happening this weekend, Friday to Sunday, and I guess much, much more. So take it away, Wendy.
Thanks, David. I'm so pleased to be here today to talk with everybody about accessible vaccination and where we sit currently in the vaccine rollout. My name is Wendy Porch. I am the Executive Director at the Centre for Independent Living in Toronto. I am a short, white, cisgendered, disabled woman with long, dark hair. And I always put on fancy red lipstick, basically, for any of these kinds of web-based engagements. So I want to tell you a little bit about the Centre for Independent Living in Toronto, where we work, where a lot of the work around the accessibility cluster sits, although very much in partnership with community members and community organizations. Just so you know, CILT is rooted in the Nothing About Us Without Us disability rights movement. We are a community-based, consumer-focused resource center, and we are by disabled people for disabled people. So we are slightly different than some disability organizations in that in our bylaws, our president and our vice president of our board have to be disabled consumers, and many of our staff are disabled consumers as well. And we think that's important in terms of centering the voices of disabled people in this work. We work towards building a society for disabled people, with disabled people, where we all experience social and economic equity. So that's the work that we're doing at CILT. And obviously it's tied up with access to vaccinations, given our current context with the COVID-19 pandemic. I should say I'm also the chair of the Accessibility and COVID-19 Vaccines Task Force for the City of Toronto. And I also sit on the City of Toronto's Accessibility Advisory Committee. And thank you, whoever just put us forward a slide here. So I wanted to speak a little bit about the need for an accessibility lens on vaccination. I think it's really important context and background information when we think through the work that we're trying to accomplish through our clinics and through this town hall and through the work with the ambassadors in the community. What we know is that people with disabilities are more likely to contract COVID and experience dire consequences of COVID if they become ill. Much of what we know about that is actually based on international data. So places like the UK, in fact, have been collecting data about the impact of COVID-19 on disabled people. A very shocking statistic that they collected about last year, between January and November of 2020, the 6 out of 10 people who died from COVID-19 in the UK were people with disabilities. So there is a pronounced impact on our community. We don't have those numbers in a Canadian context or in an Ontario context, unfortunately, and that is certainly one of the places where I think we need to do better by our community. Many people with disabilities in the community interact on a daily basis with support staff and or live in congregate settings, and this is an additional risk factor to be taken into consideration. So many people who live in supportive housing interact daily with attendants or PSWs. The same can be said for folks who live in congregate settings as well. And it's that additional exposure at the start of the pandemic when everybody was saying, you know, you have to shelter, isolate yourself. Many people with disabilities did not have those options. And so they continued to be, to have higher rates of exposure to people outside of any kind of bubble that they could control. And I think what we saw at the start of the pandemic certainly is that the needs of our community of disabled people unfortunately were largely ignored or invisible in the context of the early responses to the pandemic. So all of these things combine to point to a very clear need for an accessibility lens on vaccination. Equitable access to vaccinations, vaccines being our way out of this, frankly. So equitable access to vaccination is of critical importance for our community. And that includes not just access to the vaccines in an accessible space, it includes access to vaccination communications, booking, all the way through to the actual vaccine interaction and into the spaces past the interaction around vaccinations that include things like vaccine passports. We're going to talk about those later today. Next slide, please. So I wanted to talk a little bit about the Accessibility Task Force on COVID-19 vaccines. And as I mentioned, I am honored to work with the amazing group of volunteers that compose the Accessibility Task Force, and I chair the task force itself. The objectives of the task force are threefold. So the task force meets to make recommendations that are intended to close the equity gaps in current vaccine planning and to increase vaccination rates among people with disabilities and their caregivers. We work to share knowledge around COVID-19 infection risks and the measures that reduce risks that are specific to our community. And that includes enhanced testing and safety protocols that would be specific to disability communities. And we also work to identify, review, and address concerns with COVID-19 vaccines and any barriers that are encountered in accessing the vaccine. What I want to tell you about, okay, so this is great. We'll just stay on this slide. So ATF recommendations. This is a very wordy slide, and I apologize for that. I couldn't work out how to put some of these recommendations down in ways that were not so wordy. So these are some of the recommendations that the Accessibility Task Force has made about accessible vaccinations in the City of Toronto. We also made two large overarching recommendations. At the very start of the pandemic, it was of great concern that people with disabilities living in congregate settings and supportive housing were not yet fully vaccinated. We know that retirement homes and long-term care homes came first. And then we were looking at the broader rollout to the community, and the task force felt that there was a gap around people with disabilities in congregate settings or supportive housing. And so we made a recommendation pretty much upon formation that those folks who have disabilities and were living in those settings needed to be prioritized. And at the time, Toronto Public Health worked with us to provide dedicated spaces for people who were living in supportive housing or congregate care settings who were not yet vaccinated. So that happened very quickly. We also made a recommendation that people with disabilities generally should be prioritized in vaccination efforts. And alongside that recommendation were these specific recommendations around the kinds of things that are required for this process to be accessible to disabled people. And that includes a simplified, centralized vaccine booking process that's accessible. A way for clinic staff, for people with disabilities to indicate and to make known their need for accommodations in the context of being vaccinated. Training for clinic staff to see accommodations within a human rights lens and context as being important for disabled people to be able to access vaccines. We also recommended having a range of accessible clinics provided that included quiet and private spaces for people to be vaccinated, as well as attendance on hand, ASL interpretation, accessible materials, ways to work through the vaccination process where you don't see the needle. These were all recommendations that we made in terms of how accessible vaccination processes should look. We've also worked on a number of disability-specific clinics. So there were 2 clinics down at the Metro Convention Center that we worked on as a task force that saw more than 1,200 people come and get vaccinated. We're also working through 4 upcoming clinics, 4 locations, actually 8 clinics this weekend that we're calling super supportive clinics. And I'll tell you a little bit more about that in a minute. But these are the kinds of recommendations that the task force has made. And these are the kinds of changes that we've been working with our partners at Toronto Public Health and in the community to implement for disabled people to be vaccinated. So next slide, please. Another piece of the work that we've been working on here is SILT was provided with some funding from the City of Toronto to work with a cross-disability team of partner organizations. We have a fantastic team of partner organizations who are all grassroots disability organizations to develop specific outreach methods and communications for disabled people in the City of Toronto. And so far, project partners have deployed, all of our project partners have undertaken web-based outreach. So there have been webinars that are community specific that talk to members of their communities to address questions around vaccination, hesitancy, how does it work, what happens. So we have worked with all of our project partners and they have all individually done those kinds of outreach webinars. There is also a network of disability community specific ambassadors. So these are people from our partner agencies, many of whom are people with disabilities themselves, who are working as ambassadors to answer questions around vaccination from community members. So they're bringing their lived experience and also their experience as ambassadors to those conversations. And we're also supporting this town hall. So here's an opportunity for all of us to get together and to talk through what does vaccination look like, accessible vaccination look like in the context of the City of Toronto right now. Where do we stand in terms of next steps? And what are the kinds of barriers or concerns that people are still encountering that we need to be paying attention to? Next slide, please. So I mentioned super supportive clinics this week. So Elm Bank Community Center, November 5th and November 6th. St. Margaret's Anglican Church, November 5th and November 6th. Oak Ridge Community Center, November 5th and November 6th. And North York Senior Center, in this case, November 6th and November 7th. We are holding and supporting super supportive clinics. So these clinics will have ASL interpretation. They will have attendance, disability ambassadors from our accessibility cluster, and additional supports provided. So the important thing about these clinics, they will provide accessibility accommodations, but they are also open to members of the communities around them. And each one of these clinics has been located in a community that is historically under-vaccinated. So we're trying to provide we're trying to provide a few things. We're trying to make sure that people with disabilities can come out and have their needs met at these super supportive clinics. And also, even if you don't identify as a person with a disability, but you think you might benefit from a little bit of extra support in vaccination, then these clinics are for you. Next slide, please. So that's it in terms of me and my update around where we sit in terms of the ATF work and some of the work that the accessibility cluster is doing. And I would like to now pass it over to Toronto Public Health nurses, Jess and Jen, who are going to talk to us in more detail about vaccination. So welcome, Jen and Jess.
Thanks so much, Wendy, and thanks for having us, everyone. Okay, I'm just going to share my screen. All right. Does that look okay, Jess?
That looks great, Jen.
Perfect. Wonderful. All right, well, good afternoon, everyone. We're public health nurses on the Community Outreach and Rapid Response team here at Toronto Public Health. My name is Jennifer. I use the pronouns she and her, and I'm a white cisgendered female. I'm wearing a black and white shirt with glasses, and I have wavy blonde hair that's off to the one side. Jess, I'll let you introduce yourself.
Thanks, Jen. My name is Jess. My pronouns are she and they. I'm a white cisgendered woman with blonde past the shoulder length hair and nose ring and brown glasses, and I'm wearing a dark green shirt.
Great, thanks. So this is our introduction slide that just says Toronto Public Health Vaccine Confidence, the COVID-19 vaccine. So we understand that the choice to get the vaccine can be a very complex one and a very personal one. So our role today is to really share the best available information at this time. And we know that messaging changes rapidly as we learn more about the vaccine and about the virus and the variants of concern. So please note that with this ongoing research on COVID-19 and the vaccines, that the information that we are sharing today may change in the future. What we do is share information in hopes of building vaccine confidence to help answer questions that people might have around the vaccine and help connect to additional resources if you're looking for more information. So we do encourage you to add questions in the chat throughout, and we'll get to them at the end. That way you don't forget about that throughout. And what we do hope is that if you are vaccinated, there's new information that may be helpful for you. And for the parts that are a review for you, hopefully some of what we share can help answer some of those tough questions about COVID-19 vaccine from people in your life or people that you work with. So Jess and I, we are by no means vaccine or immunology experts, but we will do our best to respond to any questions. And if they are beyond our scope, we are happy to provide resources or follow up afterwards with links to information. Okay, so we've been dealing, or actually for this slide, there's two pictures that are on this slide. There is a black man behind a chemistry table, as well as a white woman standing next to a vaccine syringe. And the title is Vaccines, Another Public Health Measure. So we've been dealing with this pandemic for about 18 months, at least 18 months, and it's impacted us all on a variety of different levels. Throughout this pandemic, we've used a number of public health measures to protect us from COVID-19, such as wearing masks, socially distancing, and now with the COVID-19 vaccination, this has been another very effective measure to help prevent the spread of this illness. Now, we also know that the vaccine has been very effective in preventing severe illness and hospitalization from COVID-19, including the Delta variant, which is the variant of concern that's the most dominant one here in Ontario. I think about 95% of cases are the Delta variant. And this variant is a lot more transmissible, which means it can spread very easily from one person to another. As well, there's been a lot more severe outcomes. So people have been getting a lot more sick when they are infected with the virus and this strain of the virus. So there's 4 different types of vaccines that are currently approved in Canada. For the sake of this presentation, we are going to be speaking to the Mrna and the Pfizer, which are the mRNA and the ones primarily available here in Ontario. Now, currently Moderna is being offered for 25 years plus, and Pfizer is available for those 12 years and older.
All right, thanks, Jen. So the next few slides, we're going to be talking about some of the basics about COVID-19 and the vaccines. And just sometimes some of the points that we're sharing can be helpful just when you're speaking with other people in your lives as well. So what do we know about COVID-19? And we've learned a lot in the more than 1 year and a half. We know that COVID-19 can be quite serious for a lot of people. It can affect the lungs, the brain, the heart, and other organs. Many people will recover. However, some people won't. They'll become seriously ill, perhaps hospitalized. And unfortunately, thousands of people in our city have died from COVID since it started. Another thing that some people aren't aware of is that some people experience persistent long-term effects after a COVID-19 infection.
Excuse me, this is the one of the interpreters. Could I ask you just to slow down a little bit, to slow your pace? Thank you so much.
No problem. So some people also experience persistent long-term effects after COVID-19 infection, and we call them the COVID long haulers, or it's also called long COVID. There are new clinics that have opened up in Toronto to address these symptoms. So some of these symptoms include being extremely tired, persistent cough, trouble breathing, palpitations, which is a pounding heartbeat. Another common one is difficulty concentrating, also called brain fog. Trouble exercising is also another one. And what's not known is how long these symptoms can last. And even people who get mild cases of COVID-19 can have symptoms that can last for months and months afterward, and we're not finding a good treatment for it. So we certainly want to be able to prevent long COVID and COVID in general. Another question that people often ask is about the vaccine review and approval process. How did we get a vaccine so quickly? Has it been approved and reviewed properly? COVID-19 vaccines were developed quickly, but without rushing or skipping any safety steps. And this was possible because of advances in science, global collaboration, and increased funding. The technology has existed for a while, and the mRNA technology is not new and has been used before in therapeutic drugs. The enrollment in clinical trials also happened quite quickly. Many people volunteered to join the clinical trials, and they were able to be organized and completed faster than the usual clinical trial. So there's some line drawings here illustrating the points I'm about to tell you. So the COVID-19 vaccines used in Ontario have been approved by Health Canada. They've met the same safety and quality standard required for all vaccines, the same ones that people have received at the doctor's office or at school. We're under the biggest vaccination campaign in history. 57 million doses have been administered across Canada, and more than 7 billion now, actually, we're over the 6 billion. More than 7 billion have been administered across 184 countries. Over 25 million doses administered each day. Almost half of the world has received at least one dose of the COVID-19 vaccine. So COVID-19 vaccines work by teaching your immune system to recognize the spike proteins on the surface of the coronavirus. After vaccination, your immune system will be able to recognize the real virus and make antibodies to fight the infection. Just a reminder, it takes at least 2 weeks after each vaccine dose to build protection. Another myth we hear a lot is about the mRNA interacting with the DNA, and that's not something that happens because the mRNA never enters the nucleus of the cell where DNA is kept. In fact, the mRNA breaks down and is removed from the body within days. There's some line drawings here illustrating the points I'm about to tell you. So the evidence shows that the COVID-19 vaccines can provide protection even as viruses change. And we know that viruses do change. The variant we are seeing in Ontario is a Delta variant, and real world data is showing that the COVID vaccines are effective for many individuals being fully vaccinated provides over 90% protection against the variants. However, also certain groups are taking booster doses. The vaccine it's being studied how long the vaccine can provide that protection. And with recent updated recommendations from the NACI, the province will be also updating their booster dose plan, and we'll be talking about it later in the presentation.
Great, thanks, Jess. So there's a graphic here for this slide that shows a woman in a hospital bed wearing a mask. Now, the majority of COVID-19 cases that we're currently seeing, especially here in Ontario, are occurring amongst those that are unvaccinated. So unvaccinated individuals who catch COVID-19, or unvaccinated individuals, are about 10 times more likely to catch COVID-19. They're about 36 times more likely to be in hospital when they become infected with the virus, and about 48 times more likely to be a patient in the ICU compared to someone who is fully vaccinated against COVID-19. So this slide, the title says Ontario COVID-19 Dashboard. And there's a graphic here that is pulled from the COVID-19 Ontario Science Table. And it shows 3 different graphs where there's the orange line shows unvaccinated individuals, and blue line that shows the orange line that shows unvaccinated individuals, and blue line that shows fully vaccinated individuals. And these graphs clearly demonstrate that the number of cases that we're currently seeing here in Ontario and the number of patients in hospital and patients in ICU are significantly higher for those unvaccinated. So this is a great resource for individuals that might be interested in seeing the daily case numbers here in Ontario. And they do update it daily, and it does break it down quite nicely between the vaccinated versus the unvaccinated population. And we aren't sharing this graph to induce fear, but it's more to show that the vaccines are very effective. And unfortunately, we are seeing a lot of people that are still ending up in hospital and in ICU, primarily due to being unvaccinated. So this slide here, the title is COVID-19 Vaccine and Fertility. And there are line drawings illustrating the points I'm about to tell you. So this is a big piece where there's been some misinformation, especially online, around the safety of COVID-19 and fertility. So there's been a lot of information, and I'm just here to tell you straightforward that there is no impact on fertility after having the COVID-19 vaccine. So after about a year of research on this vaccine across the entire globe, as Jess mentioned, about 7 billion doses and across 184 countries, millions of people have received the vaccine and have had no concerns being able to conceive. So the studies have shown that the vaccine does not affect sperm count at all. And the vaccine has no impact on reproductive organs. There is also no evidence that the COVID-19 vaccine can impact menstruation or menopause long-term. Now, we do know that menstrual irregularities can occur in about 1 in 6 individuals that have periods. So when we look at the 7 billion doses that have been administered across the globe, and when we know about 1 in 6 individuals who have periods can experience irregularities, although the timing may coincide with having the vaccine, it does not necessarily mean that it's related to the vaccine. Now, the immune system does have a link to the uterus. So the uteral lining has immune cells that can affect the menstrual cycles when the immune system is activated. So say we are under a lot of stress, or we're feeling unwell, or we're sick. This can cause that irregularity in our periods. However, this does not mean that that irregularity was due to the virus or the vaccine, sorry. If you have experienced an irregularity after having the vaccine, we do recommend that you can report that to your healthcare provider. Health Canada does take all of these reports very seriously, and they are all investigated. However, based on the research, there has been no connection to that irregular periods or, again, that fertility piece. So this slide is titled COVID-19 Vaccine and Pregnancy, and there are line drawings illustrating the points I'm about to tell you. So similar to some of the misinformation that has been spread around the vaccine and fertility, there's also been that misinformation or myths about impacting pregnancy, and all of those are false. All pregnant individuals are eligible and are recommended to get vaccinated as soon as possible at any stage in pregnancy. Now, what we do know is that the COVID-19 infection during pregnancy can be very severe. So we're seeing an increased risk in hospitalization, ICU admission, mechanical ventilation, and death compared to those that are not pregnant and are infected with COVID. So the benefits strongly outweigh the risks. Now, there's been data that has been collected, again, across the globe. Hundreds of thousands of pregnant individuals have received the vaccine, and there's been no safety signals. So again, something we strongly recommend. Now, one benefit to getting the vaccine while pregnant is you can pass antibodies to your unborn child. Now, to be clear, it's not the vaccine that passes from you to the fetus. However, it is the antibodies that our body develops to help fight infection that can be passed to the unborn baby. So it is a great benefit since, at this time, infants are not able to get the vaccine. We do recommend, if you have a healthcare provider or an OBGYN, to have those conversations with them, as they can answer any questions that you have and can help make you feel comfortable about making that decision that's best for you or your family. Now, there's also a decision-making tool that the Ministry of Health has developed. I'm not sure if Jess, you might be able to put that in the chat, or it's linked in one of our resources we'll be following up with. But it's a great one to share with anyone that you think might benefit from that. Now, this slide is titled Myocarditis and Pericarditis, and there are line drawings that are illustrating the points I'm about to speak to. So there's been a small number of individuals that have developed myocarditis or pericarditis after having the vaccine, and has been considered an adverse event after having that vaccination. What myocarditis and pericarditis is a type of inflammation in different parts of the heart. So what this looks like, what these cases look like, it's typically someone will have chest pain, trouble breathing, or irregular heartbeat after having vaccination. Again, this has been a very rare occurrence that it has happened after vaccination, but it typically occurs after the second dose. Where they've seen it, it has typically occurred among men over women, and typically occurred among teens and young adults. So because of this, the province has updated their recommendations for the use of the Mrna vaccine, and has recommended that Pfizer now be the vaccine of choice for those 18 to 24 years. So it should be noted that the cases of myocarditis and pericarditis that have developed after the vaccine have been very mild and have been very treatable, typically with just rest and some anti-inflammatories. People have made very good recoveries. It should also be noted that individuals that have developed just the COVID-19 virus are at much higher risk of developing myocarditis and pericarditis. And these cases that we have seen are a lot more difficult to treat and a lot more difficult to manage. And as Jess mentioned, with long COVID symptoms, we don't know how long these symptoms might last for people that are infected with COVID-19. So there could be long-term damage on our organs, such as the heart, the lungs, and the brain. So again, this decision was made out of abundance of caution from the province to recommend Pfizer for 18 to 24, because those rare occurrences were even less with the use of that Pfizer. But again, the benefits outweigh the risks when we are looking at, myocarditis and pericarditis developing after becoming infected with COVID-19, and those being a lot more difficult to manage. If you know someone that experienced any of these symptoms of myocarditis or pericarditis, it typically will happen within 10 days after having the vaccine, and we do recommend that you seek medical attention immediately.
So on October 7th, the Government of Ontario expanded eligibility for a third dose of the COVID-19 vaccine, and the following groups are now eligible: seniors 65 years of age and older, living in shelters, long-term care homes, retirement homes, elder care lodges, and other congregate settings. Another group that was part of that expanded eligibility are individuals who are moderately to severely immunocompromised. I've shared the link here to our webpage, which has the list. All of the links that we are sharing through the presentation are in the resource sheet that was emailed before the presentation. So definitely you can find that there as well to help you look things up. Next slide, please, Jen. Thank you. So the ministry, and there's also another link here from the Ministry of Health for third dose recommendations. And that's also in the list of resources. There were changes October 15th. There were new list of immunosuppressant medications that have made individuals eligible for third doses, and also a booster dose in long-term care residents and seniors living in other congregate settings. So those changes happened then. There's also a referral form, which is also in the links provided. And that referral form is for a physician or other healthcare provider to fill out so you can get that third dose. So ways to get vaccinated is our next slide. There's the mass immunization clinics, which do offer accommodations as well. There's parking near the entrance, ramps and elevators. Staff are also on site at each clinic to support as necessary. Clients who need a care provider or support person or a service animal, all of those accommodations are allowed. There are quiet spaces and privacy rooms available. So a lot of the same accommodations I mentioned in the past. And also, if you require an accommodation, do alert a staff member upon arrival. Translations on site sometimes are available, or a service for translations as well. There's also hospital clinics and pharmacies and mobile pop-up clinics. So the mobile pop-up clinics are some of what was shared before earlier by Wendy, and I'm also going to share one on the next slide as well. So it's one of the ones that was shared by Wendy, but it's a City of Toronto super supportive clinic, and that's happening Saturday, November 6th and Sunday, November 7th this weekend. So another resource I want to share was the Camh Clinics. They're also open. It's a lower stimulation environment. Staff are trained to adapt to the clinic to better support people with mental illness, substance use disorders, dementia, and other neurodiversity. So definitely that's also an option. You can email vaccinationclinic@camh.ca if you require further specific supports. And those links are in the resource sheet we sent out. I'm also sharing another link here for how to talk to family members about the COVID-19 vaccine. We know this is something that is a difficult conversation to have with people in our lives. So there's a great link there as well. So another question we get often from people is, can you get COVID-19 after getting the vaccine? So we want to remind people it takes 2 weeks to provide full protection. Also, no vaccine is 100% effective. You should still continue to follow public health advice like wearing masks and distancing. But like Jen mentioned, we are seeing that the vaccines are working to protect us, and definitely do get third doses when recommended for different populations. This will ensure that you are protected as much as possible. We are seeing rare cases, which we call breakthrough cases, of those who get COVID-19 even after being fully vaccinated. However, the breakthrough cases are often mild or asymptomatic, and they're less likely to be transmitted to others. So those who experience a breakthrough infection often have a lower viral load, a faster decrease in viral load, and can spread the virus for a shorter period of time. So even if you do get COVID, it most likely may be mild, and you are less likely to transmit it to others. So it's still a great way to protect yourself and others in your family or community. Public health measures continue is the next slide. And there's some infographics here just showing some of the public health measures that we should still continue: wearing a mask or face covering, staying home when sick, maintaining physical distancing, sanitizing, and washing your hands regularly.
Okay, so this is titled Getting Your COVID-19 Vaccine at the Same Time as Your Influenza Vaccine. So it's very important for everyone who can be vaccinated to get their flu shot this year. The flu vaccine does not protect against COVID-19, but it will protect you from the flu and reduce your chance of getting very sick from it. Getting the flu vaccine also helps protect our healthcare system from being overwhelmed with additional patient visits. Now, we do know, based on recommendations from the NACI, that COVID-19 vaccines can be given at the same time as other vaccines, including the flu shot. And there's been no safety concerns identified when routine vaccinations are given at that same time or within days of each other. Now, there can be increased temporary side effects. So side effects of any vaccine or the COVID-19 vaccine may be, tender or red arm. Sometimes people may feel a bit of a headache or feel unwell. This usually lasts about 1 to 3 days. So if you're getting multiple vaccines on the same day, those side effects might be slightly increased, but again, should not last more than that 1 to 3 day period. If you prefer to only get one vaccine during a visit, you should receive the COVID-19 vaccine first, as that's really what the priority is, and we're still in this pandemic that we are seeing. So this slide is titled COVID-19 Symptoms in Comparison to the Flu and Common Cold. And there is a chart that we have here that outlines all the different symptoms and breaks it down for the coronavirus, the cold, and the flu. As well, there is a graphic of our COVID-19 screening poster that has all the different types of symptoms, such as fever, cough, trouble breathing, loss of taste or smell, nausea, vomiting, or tired and sore muscles, which are symptoms of COVID-19, and pictures that go along with it. So this chart will be linked in the resources as well from Jess, and it does show the different types of symptoms. And with COVID-19, a lot of the symptoms are very similar to the cold and flu. However, in general, with fever, it's very rare to have a fever with a cold. Other ones that notable is, typically shortness of breath can come with coronavirus. With the cold or flu, we typically don't have shortness of breath. So a chart that I would recommend taking a look at afterwards or sharing with anyone that you think might be a helpful resource. Now, it should be noted, if you are having any symptoms of COVID-19, it is required, or not required, you are required to isolate until you can rule COVID out. So before you enter any business, before you enter any workplace, in any business or restaurant as well at all, if you have any signs or symptoms, you should be isolating and either going to get tested or waiting for that 10-day period of isolation if you're choosing to not get tested. Now, this slide is titled, Where Can I Get My Flu Vaccine? So flu vaccines are administered at the mass immunization clinics here in Toronto. That's just one option. And as of October 27th last week, you can book your appointments online at tphbookings.ca. So that's been another link that has been shared for a resource afterwards. But you can get your flu vaccine there, and at these mass immunization clinics, they are all walk-in based for COVID-19 vaccines as well. So as of November, residents will also be able to receive their flu vaccine at local pharmacies or through family doctors. Now this slide is titled Help Prevent the Spread of Misinformation. And there are images here of individuals playing telephone, which is kind of how misinformation can spread from one person to another. Now, when we hear about COVID-19 vaccine and COVID-19, it's important that we're reviewing credible sources. We're receiving a lot of information about the vaccine and the virus over this last year and a half. And sometimes it's difficult to know whether the information we are receiving is credible. And there is a lot of misinformation that's out there, especially online. So I do think we have a bit of a responsibility to help prevent the spread of misinformation and make sure that if we are sharing information or resources with friends and family, that it is from credible sources. So some tips to help prevent the spread of misinformation is to consider the source of where that information is coming from. Looking at the website, the author, or the date it was published. Reading beyond the headlines. Sometimes the headlines can be quite misleading, but the context of the article often paints a very different picture. Understanding whether that article is fact or opinion based. Are there sources that are cited in there, or is this just one author's opinion on the virus or vaccine? And could there be a certain, motive or bias towards one versus another? And then also verifying information you receive. It's really important to fact check. And I think doing your due diligence to make sure that the information you're receiving is valid and credible. So a family healthcare provider is a great place to go if you do have questions. And we're going to be providing some more resources if you don't have a family doctor and if you have more questions. So sometimes if you found an article online and you're not sure if it's credible or not, you can always share that with the healthcare provider and see if they've heard anything about that research and if they can speak to that or be able to provide the best available information from their point of view.
So mental health is health. And we know that this last while has been extremely hard for a lot of people. And just a reminder that you are not alone and there is some support available. We're sharing this resource from the city, 211. You can reach out for help to find mental health support 24 hours a day and 7 days a week. This slide is vaccine information resources. So the first one is Ontario Provincial Vaccine Confidence Center. The phone number is 1-833-943-3900, and they're open 7 days a week from 8 to 8. Another resource that's great is VaxFax from the Scarborough Health Network. It's a one-to-one phone consultation with a doctor. So it's really great if you have specific medical questions or if you know someone who would benefit from speaking with a doctor about COVID vaccines. So they can book an appointment online or call that number. Also, those resources are shared in our resource sheet and as well as with the slides later that we'll send out. The next service is a Sick Kids COVID-19 vaccine consult service. It's a by appointment phone service only. You can book online or at the phone number. And again, this is for youth 12 plus. In the future, there'll be, once there's approval for 5 to 11, they'll be able to answer questions for that. But for now, it's for youth 12 plus and their parents or caregivers. And lastly, this is our information from Toronto Public Health. Our number is 416-338-7600. The TTY is 416-392-0658. We're open 8:30 a.m. to 8 p.m. 7 days a week. So you can definitely call for more information or to figure out what announcements are coming from the province and what's happening next. Around November 15th, we will be reducing the hours though. So just a note of that. I think it'll be open till 4:30 p.m. instead. You can also text the word vaccine to 1-833-750-0888. You can also follow us on Instagram or Twitter at TO Public Health. And there's also our website there. And again, these resources are shared in the resource sheet. So we hope that they could be beneficial for you. Thank you so much.
Perfect. All right, so that's the end of our presentation. So I can pass the reins back. And if you want to continue sharing your screen on your end, we're good to go. Thanks.
Thanks, Jennifer. Thanks, Jess. We'll go on to the next slide. Oops. Hi, my name is John Massa. I'm the Independent Living Skills Coordinator at the Center for Independent Living in Toronto. I use he and him pronouns. I am a white cisgendered man with a mobility disability with complex care needs. I have short black hair, a black mustache, and I'm wearing a blue t-shirt. Just as Jennifer and Jess were saying, as a disclaimer, the information that's going to be presented today is dated as of November 2nd, 2021, and there could be changes. And so I suggest that you follow the resources that are going to be attached to this presentation for any updates, especially with regards to the vaccine policy. The policy that I'm going to be talking about is the Ontario government's proof of vaccine policy. Now, there are barriers. Not everyone has smartphones. Not everyone has a data plan. Not everyone has a computer or internet access or a printer or the ability to navigate the provincial website. What is hoped here is that we can provide some answers to assist you to be able to get the current vaccine receipt without the QR code or with the new enhanced vaccine receipt with the QR code. And these are some frequently asked questions that we will go through as we move along through the presentation. So we'll go on to the next slide. So most of us have a vaccine receipt without a QR code. That's the one you received when you got your initial or your second vaccine dose. And that is the vaccine receipt that you can use. If you can't find that paper copy, or in my case, my second dose copy became faded, I gave them my email address, and you could search in your inbox under COVID-19 vaccination receipt or dose administration receipt. And then you can print it out or take a screenshot of your emailed receipt and show it as proof of vaccination. We'll go on to the next slide. So I asked myself, we've been hearing about this new enhanced passport, or really it's a receipt with a QR code. And I said, what is a QR code? Like, what does that mean? So it's short form for Q, quick, and R, response, quick response. That's what QR stands for. And I have a diagram of what the QR code looks, and basically it consists of black squares arranged in a square grid on a white background, which can be read by any imaging device, such as a camera or a smartphone. You don't need to have this new vaccine receipt with QR code to have proof of vaccine. You can still use your old paper copy that you got when you got your first and second dose. Next slide. So, as I was saying, your paper vaccine without the QR code still remains valid and will continue to be accepted by businesses and organizations. What the QR code does is it makes it easier, more secure, and a convenient way to have your proof of vaccination verified. You could save it on electronic version of your vaccine certificate with QR code on your phone, or you could print a paper copy of it. You still need to show another piece of identification with your name and date of birth, along with your proof of vaccination when visiting select businesses and organizations. Am I going at an okay pace?
Fabulous. Thank you for the interpreters.
Excellent. So how do you go about getting this enhanced vaccine receipt with a QR code? So the first way, step one, is you could go online if you have a green photo, the green photo health card. You go into the provincial portal, and the website is here, is https covid19.ontariohealth.ca/. And when you go to this website, it'll open a new window, and you can download your vaccine certificate with your QR code. What you'll need is your green OHIP card, and you'll need the numbers from both the front and the back, and expired cards will be accepted. You need to have your date of birth and your postal code associated with your health card. So you can do that online. So what happens if you have a red and white health card, or if you don't have a computer? You could call by phone. I have a red and white health card, so I couldn't do it online. I called the provincial vaccine booking line at 1-833-943-3900. I will also share a TTY number on the next slide. When you call the call center, an agent is going to email you a link to get a copy of your receipt. So when I called them, they emailed me a link to get my vaccine receipt with a QR code. For safety reasons, this link is active for 5 days. So they told me once I get the link, once I get the email and the link, I should click on the link, and it brought me to a new page where it had the vaccine receipt, which I downloaded to my computer. I then shared it to my phone. I have it on my computer, and I also printed it out. So I have 3 ways. I have a print version, I have one on my smartphone, I have one on my computer, so that I can have multiple ways of having this new enhanced vaccine receipt with a QR code. Next slide. So if you didn't have a health card and you got vaccinated, you should have had a COVID ID that was provided by Toronto Public Health or another agency. And you may request the new vaccination receipt with QR code by calling the provincial vaccine booking line at the number I said, 1-833-943-3900, or the TTY number 1-866-797-0007. If you've not been provided with a COVID ID, you may request one by contacting Public Health Hotline at 416-338-7600 or TTY at 416-392-0658. The COVID ID is only for accessing the COVID-19 vaccine or COVID-19 vaccine receipts. Next slide. So, as I was saying, if you don't have a computer, you can visit your local library to use a computer and internet for free. You can ask a trusted friend or organization to print a copy, or you can access it at a Service Ontario location. Once you have the new vaccine receipt with a QR code, I saved it to my computer. Then I printed it. And then I even shared it to my device on my smartphone. And out of all this, if you don't have any of these, you can ask the Provincial vaccine booking line to mail you a copy of your vaccine receipt with a QR code. It may just take like a week or two for you to get it. So it could be mailed to you. So some proof of COVID-19 vaccine requirements. In Ontario, you are considered fully vaccinated if you received vaccine certificates showing that you received 2 doses of a COVID vaccine, including combinations of Mrna, Pfizer, AstraZeneca, or COVID Shield, or 1 dose of Janssen or Johnson & Johnson. That your final dose of COVID-19 vaccine was at least 14 days before providing proof of you being fully vaccinated. And if you're not fully vaccinated, please book your appointment now at the website ontario.ca/book vaccine, or find a clinic with walk-ins near you. Next slide. Where you must show proof of vaccination. So you have to have your vaccine certificate that we mentioned with or without the QR code. You must have a Canadian or provincial government issued ID ready when entering select indoor and outdoor businesses or organizations. Businesses and organizations are required to check that your name and date of birth on your proof of vaccination matches your ID. And there will be a list of indoor and outdoor businesses or organizations that will be handed out in the resources. Due to time and wanting to have Q&A, I will skip that part. So it'll be in your resources. So you can either provide a paper or an electronic version of your vaccine certificate with QR code, or a paper or electronic version of the PDF vaccine receipt that includes your name, date of vaccination, and brand of vaccine. It'll be on your vaccine certificate. You can use a digital or printed receipt that you received from the clinic where you got your 2nd dose, the Ontario Provincial vaccination portal that I mentioned, or another jurisdiction, or an Indigenous health provider, must be signed, or Canadian Armed Forces. Next slide. You must not alter the appearance of your vaccine certificate. It will be invalid if you do. Vaccine certificates can be laminated, but it may impact the readability of the QR code when businesses try to verify it. Please ensure that any information you provide is complete and accurate. Next slide. So some proof of identification and personal identification. So some examples. When you enter a business or organization, they'll ask you for your ID and your vaccine certificate, and you have to have the following examples. The photo ID is not required, but examples of birth certificate or a passport or citizenship card, Indian status card, or Indigenous membership card. Next slide. Some exemptions. You don't have to show proof of vaccination if you're under 12, under the age of 18 and entering an indoor premise of an indoor sports or recreation facility solely for the purpose of actively to participate in an organized sport, entering a business temporarily to use a washroom, access an outdoor area that you can only get to by going indoors, making a retail purchase, place, pick up or pay for an order, make a bet or pick up winnings at a racetrack, purchase admission to most things that you have to buy, or entering the business for health and safety purposes. Next slide. So there are some medical exemptions as well. If you are unable to be fully vaccinated for a medical reason, you need to show a written document from a physician or a nurse practitioner. It must include the name and contact info of the physician or nurse practitioner who wrote the note. It must be on the logo or letterhead identifying them, and a statement that there is a medical reason for your exemption from being fully vaccinated against COVID-19, and that there's a time period for the medical exemption. Next slide. So that is just a brief summary of applying for the COVID vaccine certification with a QR code. And I'm going to pass it back to Wendy and David for questions and answers.
Thank you, John. I learned quite a bit in that presentation. Thank you very much, John, for explaining the process for proving vaccination to everybody and what some of the varying routes are through that. So just wanted to open it back up and let people know, first of all, we're hoping to work into questions and answers now. So if you have questions that you would like to ask myself or John or Jen or Jess, please let us know. We are recording. I just want to remind everybody. So if you don't wish to have you recorded asking your question, then please send your question in the chat to Rebecca, and Rebecca will read it out for us. But we do welcome, if you feel comfortable, unmuting and or putting your camera on and asking any questions that you might have at this time. So any questions, anybody?
Yes, hi.
Hi.
Hello.
Hello.
Hi, this is Mrna. I'm a vaccine ambassador, and I have a question that one of the person I'm working with took the one vaccine from the Saskatchewan and the second dose in Ontario, and both receipts says first dose.
And how does that get managed, I guess, is your question, Mrna.
Yes, how I did call to the public health number, and we find out it's how do I get the receipt that says second dose, and I submit them, but it takes 8 weeks. Meanwhile, this person is looking for a job and he's stuck with everything. So how do we solve those problems?
It's a great question. I wonder if I could ask Jess and Jennifer if you have any thoughts on where Mrna could go for assistance with this, or John.
Yeah, I'm happy to speak to that a little bit. It's really unfortunate the time it's taking to process these vaccines that are reported from out of province and out of country. So I'm assuming that's the process that you're speaking to, that they've connected with Toronto Public Health and done that, because that's what's recommended is if they had a first dose done out of province, that there is a link on the Toronto Public Health website to report that. And then once that's in the Ministry of Health database, they would be able to see that there was a second dose done in Ontario that says dose 1 and adjust that date or adjust that title to say dose 2. But unfortunately, the team is working as quickly as possible, but they have to manually input every single vaccine receipt that's been reported out of province. And there is a significant backlog. So it is taking a lot of time, whether it's 8 weeks, you know, I would hope it wouldn't take that long, but if that's what they're saying right now, unfortunately, there isn't really another solution at this time, since it really is you know, the public health units that are updating the provincial portal. I mean, if they were to be applying for a job, I would recommend, you know, bringing both receipts, because I mean, you should be able to see that, you know, Pfizer dose 1 and Pfizer dose 1 could be done on 2 different dates to show that there are at least 2 doses. And hopefully whoever was, you know, looking at that to consider whether it's a full vaccination, they would be able to see that they did receive 2 doses, just the titles are wrong. So unfortunately, you know, logistically or administratively, it's a bit of a mess, and it can take a long time. But my only recommendation would be just for them to show those 2 doses and the receipts that you do have, even though they both say dose 1. If their name, date of birth, and the vaccine they received is on there, I would hope people would understand that that was just more an administrative issue. Jess, I'm not sure if there's anything you can add to that or want to add to that.
Yeah, just completely what Jen said is correct. So I don't have too much to add except maybe a creative solution and workaround. So the problem is that for anyone who got a dose out of province or out of country, there's no way in the provincial system to count for that other than manually putting it in. And now there are huge delays because that wasn't organized in the system, and now there are huge delays. Perhaps maybe they could be connected with a community health center or Access Alliance or some sort of group that works with people who are newcomers and understands these issues. And maybe a nurse or doctor could write a letter explaining that the 2 doses are a fully vaccinated schedule, that, you know, just because it doesn't say the second dose, like the dose is the same, right, for both doses. So that shouldn't be an issue. So maybe that could be a workaround until that 8 weeks is up. But yeah, it's really hard and it's creating a lot of issues. So yeah.
Mm-hmm. Thank you to you both. Kashmira, does that answer your question? There's a couple of options, it sounds like there.
Yes, I did get it. But the one more thing I wanted to add into it, because he doesn't have a Ontario health card, and the other dose from the Saskatchewan doesn't give the proper receipt. It just gives his name and date, and that's the first dose. There is no date of birth. There is no other information. It's just a small card. And I don't know, I did submit, but I guess I need to wait for the 8 weeks. That's what only we can do at this point. But thank you very much. It's been very informative session.
Thanks, Kashmira. It sounds like the suggestion from Jess too is that maybe connecting with Access Alliance is a place to start as well. And if they might have some other suggestions for you, and including the suggestion around maybe a doctor looking at both of those pieces of paper and putting together a letter. So there's a couple of different options there. And thank you both for those suggestions. I think they're good ones. We have Razia as well, who has their hand raised. Do you want to ask your question?
Similar question to those folks who get the vaccine out of province or out of country. Another struggle is they get 1 dose out of province and then they want to get the 2nd dose here. At the beginning, when the vaccine rolled out, we're able to give them the 2nd doses, but the new practice is not to give them the dose until it's registered with the system, in my understanding. So then these folks are waiting until the system recognizes that they have 1 dose, and then only they can get the 2nd dose. So that's my concern, that we have a number of people who are waiting to get their 2nd dose. How are we going to address it?
It's a great question. Again, I'm going to defer to Jess and Jennifer. Have you heard this from other folks? And is there any kind of particular plan for remediation? Because obviously we don't really want people waiting for second doses either, I would imagine. So
yeah, this has been a concern that we've been hearing about for 6 months beyond. It's been an ongoing issue and a significant barrier for those that had vaccines out of province, because we do recognize that without that first dose documented, if they were to go to another clinic or a pharmacy to say, I need my second dose, there's no record of that first dose being in there. So they won't administer that second dose and document it as dose 2 because it's being documented technically incorrectly. So I mean, there are some clinics, we have heard through the grapevine of some pharmacies that might still administer that second dose, even though it may come up as dose 1 because they don't have record of it. I mean, you're fully protected still from having those 2 doses, but again, we're looking at more of an administrative issue with having then 2 receipts that say dose 1, and us then now still having to report it through the provincial portal. And as that first question we received, it taking 8 weeks for that to be adjusted. I mean, we're still looking at that same timeline. So really, unfortunately, I mean, this has been something that continues to be brought to the attention of Toronto Public Health. You know, Jess and I both worked on the hotline for a significant period of time before coming into this role. So we were taking a lot of these calls and dealing with a lot of these issues. But unfortunately, I mean, that team is working as quickly as they can with the resources and the bodies that they've been allocated to work in that program to get that done as quickly as possible. But there really isn't a workaround that is as very straightforward, other than just, you might get the odd pharmacy that might still administer a second dose, even though that first one's not in the system. But then again, you're going to get a receipt that says dose 1 instead of dose 2, and then that will still have to be corrected in the portal.
okay.
But what I hear, Jennifer, thank you so much for that info. But what I hear also from the clinic, the risk of getting, the person who is administering that vaccine, not knowing if that person got 1 dose or 2 doses out of province. So then they end up getting the 3rd dose. Because what I heard is there were some scenarios like that they reported 1 dose, then they got the 2nd dose from the clinic, but in real fact, they actually had 2 doses out of province. And just because at the clinic level, they didn't have that information, they administered the dose, but then later on realized this person has. So there are some risk factors, which I understand, but if there is any way to speed up that process, because the more we're trying to encourage people to get fully vaccinated, for 1 or 2 of those incidents, it's putting the other people behind who are not playing with the system so much.
Mm-hmm. Thank you, Razia. I think it sounds like it's unfortunately a known issue as well, that Toronto Public Health is trying to work through. It's not great.
It's not. And I mean, I would recommend, if you want to email public health at toronto.ca, I'll put the email in there. I mean, advocating for, the populations that you work with, for the residents that you work with, and continuing to bring that issue forward. I mean, that might help. And I mean, the more that, the public health units in the province hears that this is a barrier and an issue, I mean, hopefully it will, help change that practice a little bit. But unfortunately, it's been a huge issue for a significant period of time. So unfortunately, they're not alone in this, but I mean, it is really truly unfortunate that people are having to wait that long to even just get that level of protection, which they ultimately want.
Yeah. Thank you, Jennifer and Jess, and thank you, Razia, for your question. I'm looking at the time. We have 4 minutes left. I think, Rebecca, you had a question that you wanted to add. We had some questions that were emailed in before today's town hall. So Rebecca, do you want to go ahead and read the question that you have?
Yeah, there's a quick question for Jen and Jess about the comparison between COVID, cold, and flu, and whether the loss of taste and sense of smell, whether that symptom is listed on the chart that you shared, and whether that's a symptom that is only coronavirus specific, or whether that can occur with colds and flus as well.
Yeah, I'm just taking a look at the chart right now, and the chart that does compare it, which this chart is from, I think, Alberta Health Services, it really doesn't have a loss of taste or smell across all three. I mean, that has been a predominant and one of the main symptoms that we have seen for coronavirus. I think prior to this, it's not one of the cardinal symptoms of a cold or flu. I mean, when we have, a stuffed up nose, often, I mean, that can impact our taste and smell, but it is a little bit of a different symptom than those that individuals that have COVID-19, what they experience. So I would not say that is one based on the information that we have. Again, not included on that chart, but from the information that we have is not, the loss of taste and smell has not been one that has been recognized, I think, in the past for cold and flu. So just kind of COVID-19 infection predominantly.
Yeah, I'll just add to that there is like usually some reduced loss of smell, perhaps taste in cold and flu, but I think the hallmark of like that, decrease or complete loss especially is quite, is usually something new that we've seen with COVID-19 or something that's particular to that. But again, if you are confused, do speak with your healthcare provider. They know your medical history best and they can help discern. But definitely if you're having a decrease or loss of taste or smell, that is a COVID-19 symptom and definitely one where people should get tested or isolate for sure. Yeah.
That's great. Thank you both. So it sounds like a complete loss of taste and smell is a little bit more of a hallmark in terms of COVID-19.
Yeah, but decrease is still for COVID-19 part of that. But yeah, cold and flu is not something we usually hear of a total loss. So yeah.
Yeah, great. Thank you. And I think actually, unless anybody has any really urgent questions at this point, given the time, I think we'll wrap up. And I just wanted to say thank you to everybody who supported this town hall today. On the slide deck is the list of project partners that we have in our vaccine engagement accessibility project. So Autistics for Autistics, the Alliance for the Equality of Blind Canadians, Balance for Blind Adults, the Canadian National Institute for the Blind, SILT, Deaf Spectrum, the Empowerment Council, Ethno-Racial People with Disabilities Coalition of Ontario, the GTA Disability Coalition, the Miles Nadal Jewish Community Center, North Yorkers for Disabled Persons, the ODSP Action Coalition, Silent Voice Canada Inc., and Working for Change are all valuable partners in the vaccine outreach work that we have been doing as a community. So thank you to all of you. Thank you to Jess and to Jennifer from Toronto Public Health for being here today to answer questions and to talk us through your presentation about vaccination and the importance of vaccination. Thanks to John for everything that you did today too in terms of the proof of vaccines discussion. It's very interesting stuff, very relevant for everybody, especially knowing what the options are. And thank you to all of you who came out to join us in this conversation today. If you have any additional questions, you can certainly reach out to us through Rebecca or through Kim and let us know what questions you might have. Please keep an eye out for our super supportive clinics this weekend. If you know anybody in those neighborhoods, if you know anybody with a disability who hasn't been vaccinated yet, or anybody who might require a little bit of additional support, please let them know about those clinics. And thank you also to the field staff and our partners for all of the work today. And we wish you well. Thank you, everybody.
Thank you so much for giving us very informative information so I can pass on to my community and senior and everybody. Thanks so much. I really appreciate it. Good job.
Thank you.
I learned a lot
thanks
today.
for being here. Oh, that's great. Thank you.
And thanks to the ASL interpreters, Francine and Sharon.
Yes.
And our captionist, Tori. Thanks to you, we can get this out to a lot of other deaf and hard of hearing folks who were not able to be here today. So thanks a lot.
Thank you, everyone. Thank you.
Yeah. Thanks, everybody.
Thanks.
Bye. And stay